Welcome to COVID-19. I'm Min San-hee. The global death toll has surpassed 900,000 and nearly 28 million cases have been reported worldwide since the initial infections in China late last year. We have more on that later on the program, but first, here are the latest numbers on the pandemic with our Kwon So-ah. So I hear there's been yet another rise in new cases on this Wednesday here in Korea.
Yes, Sunny, an increase by 20 new cases, but still well under 200. Health authorities are looking forward to further effects of the social distancing measures, which should show clearer results beginning next week. Now, what they do want is get those triple-digit figures to the double digits before the Chuseok holiday. This Wednesday, Korea reported 156 new cases, raising the total to 21,588, and there were 3 additional deaths, raising the death toll to 344. Some 4,200 people remain in quarantine, while the country has over 17,000 recoveries. Now, we are seeing an on-week drop by around 100 because last Wednesday we had 267 cases, and as I said before, cases are now in the 100s. For the 7th consecutive day, we are safely in the 100s. And if we go over to our map now, most cases are still concentrated in the metropolitan region, with 49 in the capital Seoul, 55 in Gyeonggi-do province, and 1 case in Incheon reported this Wednesday. That's 105 in the metropolitan region. We also saw a double-digit figure here in the southwestern city of Gwangju with 17 new infections. And this Wednesday, the country also reported 12 cases from abroad.
Right. Meanwhile, on the international front, so as I mentioned at the start, we hit another grim milestone in the global death toll.
That's correct, Sunny. As of Wednesday morning, Korea time, in many other countries, Tuesday, the global COVID-19 death toll surpassed 900,000. And this is a concern, but the World Health Organization actually said that there was a 2% decrease in deaths last week, but new infections reportedly rose by around 5%. That means we will see these figures grow. In fact, we have almost 250,000 new cases reported in the past 24 hours, and that brings the total to over 27.7 million cases, and another rise in the death toll. As of noon Korea time, the death toll has now surpassed 1,800 with some 5,000 new fatalities, and recoveries stand slightly below 20 million. And let's go over to the major outbreaks around the world. We see, let's focus on the death toll today. The U.S. has the highest number of fatalities at around 194,000, followed by Brazil at some 127,000. And although India's death toll remains lower than these other countries, this country has reported almost 90,000 new cases again in a day. And also we see here Peru has surpassed the 30,000 mark when it comes to the death toll. Let's move over to other places. Mexico has surpassed South Africa in total accumulations of now at 642,800. And Argentina here has surpassed the 500,000 mark. Just yesterday, the number of deaths has exceeded 10,000. And those are the figures I have for now, but I'll be back with more after the afternoon briefing. Back to you, Sunny.
All right, so thank you for that. I'll see you back at the desk. And back on the local front, authorities are urging members of the public to get their flu shots this year to allow for better health protection amid the pandemic. I have Kim Han-ul in the studio with me to tell us more. Welcome, Han-ul.
Good afternoon.
Right, I believe the free flu vaccinations for children started yesterday. Han-ul, please do elaborate.
Sure. The KCDC announced earlier this week that they will be expanding free vaccinations to the public free of charge to make sure that as many people get immunized as possible. So the government will offer free immunization shots to 19 million people, 37% of the total population. And this is roughly 5 million more doses compared to last year. What's different about this year is that the government has expanded free vaccine coverage to include teenagers aged between 13 and 18, as well as those aged 62 to 64. Children under the age of 9, the elderly, and pregnant women will again be eligible, as they were last year. Infants aged between 6 months to 9 years of age can receive free flu shots until April next year if they've never been vaccinated against seasonal influenza. Well, if they have been vaccinated once before, they will have until the end of this year. And after that, it won't be free. So the elderly, which now includes those aged 62 or older, has until the end of this year. And pregnant women can get free flu shots until the end of April.
Right. Now, authorities appear concerned about the possibility of a severe flu season coinciding with a rise in COVID-19 cases. What, Hanul, are some of the challenges they face in this regard?
We're talking about a number of challenges here. First of all, we could see a shortage of strain 4 vaccinations in the nation because this comes as the government expanded its free vaccination program to cover a wider range of flu vaccine strains this year. So take a listen.
The vaccines offered by the National Immunization Program this year will offer protection against 4 strains, up from the 3-strain vaccines last year.
Because a larger number of 4-strain vaccines will be supplied to the government program, some healthcare providers are having trouble securing enough of them to offer it to those who are not eligible for a free flu shot. On top of that, the so-called twindemic could put more strain on our healthcare system because although not as quite frequent, people could still have complications from influenza and end up being hospitalized. So it makes sense that if we can prevent a seasonal flu epidemic, we will have more healthcare resources available to look after COVID-19 patients. So also we should note that COVID-19 and the flu are characterized by very similar symptoms. So we might see more people getting themselves tested as a result.
Right, so telling the two apart is quite tough then.
It's not very easy. The symptoms are very similar, and we're going to hear a lot about this during the flu season. The symptoms, like I said, might be similar, but COVID-19 and the flu are very different viruses. So let's take a look at how they compare head to head. First of all, in terms of infectivity, COVID-19 is much more contagious than the flu. Also, the average incubation period for COVID-19 is around 5 days. And for influenza, it's around 2 days. For people who have contracted COVID-19, they are thought to be most contagious 48 hours before the onset of symptoms. For the flu, however, they are more likely to transmit the virus to others after the symptoms start to show. There's also a difference in terms of when the symptoms peak. For COVID-19, it could be 2 to 3 weeks later, and for the flu, it's anywhere between 3 to 7 days. Well, one symptom that is unique to COVID-19, however, is the loss of one's sense of taste and smell. But our understanding of the virus is still limited as we're still in the early stages, so more research needs to be conducted.
Of course. Hannah, there's also talk about a dual-purpose test kit for both the seasonal flu and COVID-19. Tell us more about this.
Sure. The KCDC announced that they are looking at test kits that can detect both COVID-19 and the influenza virus. According to KCDC, several institutions are waiting for the approval from the Ministry of Food and Drug Safety for these test kits. But it could take some time before these kits become available to the general public. So the best way to protect yourself is to get your flu shot as quickly as possible because it takes at least 2 weeks for the shot to take effect.
Right, well, that's good to know. All right, Hannah, thank you for that coverage. Hope to see you again soon.
Thanks for having me.
Right, it's a little after 2 in the afternoon here in Korea, and we're poised to join the regular afternoon briefing on COVID-19. As part of the enhanced social distancing in the capital area, parts of the Hangang Park, including the Panpo Park, Tuksan Park and Yeouido Park, have been closed to the public. Also, convenience stores, dining places, coffee shops and even parking areas located inside the Hangang Park will close at 9 in the evening. The latest move comes amid a surge in the number of people seeking Hangang Park as a social gathering venue after 9 in the evening, when dining establishments in the Greater Seoul area closed doors given the recent tougher social distancing in the metropolitan area. The 2.5 social distancing is to last until this Sunday, while the rest of the country has to abide by level 2 social distancing until the 20th of September. Now, we're still waiting for the briefing to start, and while we do, perhaps we can take a look at the social distancing guidelines under level 2. A maximum of 50 people can be indoors for any gathering, while a maximum of 100 has been recommended for activities outdoors. But do remember that here in the metropolitan area, the number of those who can gather for a public rally has been limited to 10. Sports games, including those for baseball and football, can take place, but in the absence of spectators at stadiums. With regard to high-risk facilities, buffet restaurants, bars, singing rooms and internet cafes remain closed across the nation, while here in Seoul, Incheon and Gyeonggi province, all dining establishments have to close doors at 9 in the evening. Franchise coffee shops in the metropolitan area are only allowed to offer takeout services. For the rest of the country, however, franchise coffee shops do not face such restrictions. All indoor sports facilities in Seoul, Incheon and Gyeonggi province have also been asked to suspend operations, as have cram schools and the so-called study cafes. Now, I understand the briefing is about to start. We'll probably come back to you afterwards with it, with our Konsoa for a summary of the key announcements.
중앙방역대책본부 수요일 정리.
We have Director Chung Eun-kyung with the briefing.
먼저 정은경 본부장 설명.
First of all, here is Director Chung Eun-kyung with the explanation. Let us now begin our regular briefing for the COVID-19 response here in South Korea. As of September 9th, Wednesday, we have a total of 144 new local infections and 12 new imported cases. The total caseload now stands at 21,588. As of yesterday, we had 387 more people being discharged following full recovery, while 4,221 people remain in quarantine. We have 154 people who are critically ill, and we have 3 additional fatalities as of yesterday, and the accumulated death toll now stands at 344. I extend my deepest condolences to the deceased and the members of the bereaved families. Let us now look at the updates on our major domestic transmissions by cluster. In relation to the Kupang Songpa second camp in Songpa-gu District, Seoul City, we have 2 additional cases being confirmed. In total, we have 12 cases being confirmed to date. And in relation to the August 15th Seoul rally, we also saw that 12 of the confirmed cases have been recategorized. And we have recategorized these cases as 551. And we have found also in relation to the Nichiren Soshu Seoul Mission, which is a religious facility, we have additional cases, and 14 cases have been confirmed to date. And in relation to a family gathering in Ansan City, Gyeonggi-do Province, we also have 12 more cases being confirmed. In total, we have 13 cases being confirmed to date. And in relation to a health supplement business seminar in Daejeon City, we have 7 additional cases being confirmed, and we have found that these cases were confirmed to a business establishment also with additional cases being confirmed as well. And we have also confirmed that 7 additional cases have been confirmed as for a traditional restaurant in the traditional market area in Gwangju City as well. And in Ulsan City, we also have found 6 additional cases being confirmed, and a total of 7 cases have been confirmed in relation to the Hyundai Group there. And we also have 12 new imported cases today. 4 of them have been reported through points of entries, while the rest of the 8 have been reported on self-quarantine. We have 4 from Russia and 2 from Uzbekistan. We have seen a surge in the number of elderly patients as well as those who are in critical conditions. And during the past 2 weeks, we have found that 36.2%, which is about 3.3 percentage points higher than the previous 2 weeks, have been accounting for the senior citizens over the age of 65. And as you can see in the enclosed graph, you can see that many of the proportions of the confirmed cases are above the age of 60. And in line with this, we also have an increasing number of critically ill patients. And out of of the 154 critically ill patients today, we have about 86% of them, or 134 of them, being over the age of 60. And please, we ask you to take particular precaution if you are at these high risk groups, including those who are seniors of age, and especially because you have a higher risk of developing severe symptoms. And we have seen that these cluster infections centering around senior citizens are spreading through religious facilities and door-to-door sales facilities as well as nursing facilities. And please take particular cautions. And we advise all of the religious facilities to switch to non-face-to-face means. And we ask you to cancel and postpone all of the social gatherings, social events, and gatherings, small gatherings as well as group meals. And as for the mid to senior age citizens, we ask you to refrain from going to the information seminars that are held by these door-to-door sales facilities, as well as other similar health supplement business seminars as well. And as for the nursing hospitals and nursing homes and health clinics that are frequented by senior citizens, we ask you to sterilize frequently touched spaces, and please have a strict restriction on the number of visitors. And as for the workers who are working at these facilities, we ask you to refrain from visiting high-risk facilities and refrain from having social gatherings. And if there are anyone who have suspected symptoms, please get tested as soon as possible, and always abide by quarantine measures, including wearing face masks and washing of your hands if you are working and if you are staying at these facilities. And we also ask the senior citizens to refrain from making outdoor visits and also reduce social gatherings as well as physical contact with others. And if you feel sick, if you have fever or respiratory symptoms, please get tested as soon as possible by visiting a nearby screening clinic. And we ask the rest of the citizens to strictly abide by the public guidance for level 2 social distancing nationwide. It is all about decreasing the number of and the amount of physical contact. So please note that meeting with others has a risk of infection. So please refrain from non-essential gatherings, outings, and events or travel. And rather than eating outside, eating and dining in at restaurants or cafes, please order takeout or delivery. And home training or outdoor exercising is recommended in place of going to indoor gyms. And also wear your face mask at all times when you have to go outdoors. And you need to cover your nose and mouth completely when you wear these face masks, and do not touch the surface with your hands. And you need to keep at least 2 meters of healthy distance with others. And please refrain from going to places that are crowded, confined, close contact environment that are poorly ventilated. And starting from the 3rd of September, we are seeing our on-day increase decreasing to about 100. Of course, this is less than we have expected. And however, nevertheless, we are also seeing a clear downward trend in the on-day increase. And we believe that these are the effects of many self-employed enduring difficulties and inconveniences, as well as many of our individuals, public, enduring these difficulties as well. And please also, we ask you to continue to practice social distancing so that we can recover a safe, routine daily lives. And also in order for our efforts to bear fruits going forward, we believe that social distancing cannot be successful without the participation of the public. And in the metropolitan area, we need to further tighten our screws and going forward, especially during the rest of this weekend, and also practice a social distancing, intensified social distancing, that is, in the metropolitan area. We need to lower the risks of infection by decreasing our physical contact with others, and we need to also minimize our gatherings and social events as well. And if you have to meet with other people, please wear your face mask and keep a healthy distance of 2 meters. And also these social distancing and government's quarantine measures, as well as medical responses, when they are met together, we believe that we will bear a fruition with our ongoing efforts. Thank you very much.
출입기자단으로부터 받은 질문 먼저
Right, that was Wednesday's afternoon briefing by Chung Young, the head of KCDC. Swa, what was the gist of her address today?
Well, Tong talked a lot about the high-risk age group today, which is the people aged 60 and above, especially because it looks like in the past 2 weeks, there were over 36% of patients who were aged 60 and above. And also, many are still in severe or critical condition. As of this Wednesday, we have 154 people in such condition. And out of these 154, 86% again were above the age of 60. So that is why she again stressed that people in that age group, but also any other age groups, should refrain from gathering at religious services, door-to-door businesses, as well as she mentioned that there has been also cases at nursing homes and health clinics. So to be really careful when you're at such facilities. And she mentioned that we have been seeing a decline recently with cases stabilizing in the 100s since the 3rd of September. But the decline is still slow, which is why she asked for the nation's people to abide by the social distancing measures, which are at level 2.5 here in the metropolitan region until this weekend.
Right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
Right, the wearing of face masks has been mandated at public places here in the country to stem the spread of COVID-19. Now, we've touched upon this topic before, and we're doing it again today to highlight the importance of effective mask usage to ensure both personal and public health. Do take a look.
Hi, I'm Shin Se-byuk, and I am at Gangnam-yeok Station in Seoul. And as you can see, there are tons of people and cars here, meaning this place is one of the most popular and crowded places here in South Korea. And we cannot emphasize enough of the importance of wearing face masks at this moment, especially given the current COVID-19 situation here in South Korea. And when you walk around, you can see plenty of people wearing this colorful, fancy stuff, what is called the mask necklace. So why do people wear this?
패션도 되게 중요한 부분인 것 같아서 또 좋아 보이기도 해서 하고 다니고 있습니다.
마스크를 뺐다 꼈다 하기에도 편하고 잘 날아가지도 않고 잊어버리지도 않고 좋은 것 같아요.
We met and asked people why they are wearing the strap, and it definitely does as a fashion item. They also say the necklace is not only convenient, but also keeps them from losing their masks. Then the question is it good enough to protect you from the virus? So we asked Dr. Park Sung-hoon of Pulmonary Allergy and Critical Care Medicine at Hanlim University Sacred Heart Hospital.
오히려 감염의 위험성을 좀 높인다고 볼 수 있겠죠. 아무래도 목걸이 형태로 메고 다니다 보면은 안쪽이 바깥쪽으로 노출이 되기 때문에 비말 감염의 위험성이 더 높아지고.
그러면은 감염 예방을 낮추는 선에서 좀 안전하게 보관을 할 수 있는 방법 없을까요?
비닐이나 봉투 안에 보관을 하시는 게 나을 것 같고요. 대신 이 겉면을 안 만지는 게 제일 좋겠습니다. 접더라도 다 아시듯이 바깥쪽을 안으로 접어서 봉투 안에 넣고 있다가 다시 쓰시면 되겠습니다.
Though wearing face masks has become a new norm in our society, some still don't know how to wear masks properly. So the Seoul Metropolitan Government released its detailed guidelines on masks on August 31st. If you look at the guidelines, mask tucked under your chin or nose does not count. Also, you must wear face masks at workplaces. You can take off masks while eating or drinking at cafes or restaurants. Otherwise, you need to keep them on all the time, including before and after eating or drinking, and while talking to others.
The Seoul City government has revealed its plan to maintain its mandatory face mask policy until the social distancing level gets lowered from the current 2.5 to level 1. Violators can be fined up to 100,000 Korean won, or roughly $85. Until then, what is considered as most important is to wear a mask at all times properly. This has been Shin Se-byuk.
최근 코로나19 확진 후 완치된 젊은 층에서 만성 피로, 흉통, 호흡 곤란 등 후유증을 호소하는 사례가 적지 않게 나타나고 있습니다.
Those 2 or 3 nights I was frightened of going to bed because the first night I went to bed I was having recurring dreams that I dreamt while I was in the coma.
Quite a number of those who have endured COVID-19 suffer from after effects, which in some cases severely challenge their attempts to return to their lives prior to infection. For more, I have Dr. AliceHyunkyungTan from Ms. Medi Women's Hospital. Good to see you again, Dr. Tan.
Thank you.
And I also have Dr. David Kwak from Soonchunhyang University Hospital. Welcome back, Dr. Kwak.
Good afternoon.
And today, joining our talk from Spain is Dr. AliceHyunkyungTan from La Paz University Hospital in Madrid. Pleasure to have you on the show, Dr. HyunkyungTan.
Thank you.
Right, Dr. Tan, we'll start with you then. According to a study published in the Journal of the American Medical Association, 87% of those who were hospitalized for COVID-19 reported symptoms lingering 2 months after they first felt sick. I would assume that this is a rather disturbing finding. What are your thoughts on this?
Right, multiple published studies are showing the same thing, that many patients are having symptoms that linger way beyond the acute phase of the illness. In the Italian study that you just referenced, only 13% of patients reported feeling completely well or with no symptoms at 2 months after the initial illness. Also in the UK, a high percentage of patients reported feeling breathlessness, fatigue, difficulty with concentration, and this was at 4 to 8 weeks after initial diagnosis. Some of the findings are consistent with people who have been in the ICU and people who have had ARDS due to other reasons. Also for MERS and SARS, we have seen a pattern of people with persistently decreased quality of life, decreased exercise tolerance, and this can persist for 1 year. What is emerging is a picture that is showing that COVID-19 is probably much more serious a disease than we would expect for, say, a typical pneumonia or for influenza, because in these situations, the vast majority of symptoms are completely gone by 10 to 14 days after diagnosis.
Right. Dr. Kwak, what are your thoughts on these protracted symptoms of COVID-19?
Well, I think the study that was done, they chose the month of 2 months, a period of time to follow up on the COVID-19 patients. It was probably arbitrarily chosen the 2 months of time, but they saw that clear increase, well, a large portion of the numbers to have what we call sequelae, meaning an after effect of a medical condition even after the recovery of the illness. It's quite worrisome because it means that people who have recovered from the virus, people being detected of no virus whatsoever, could still have remaining symptoms, quite possibly for a very long period of time. Furthermore, enhances why it is so important for everyone to keep the social distancing measures and why we need to be extra careful not to get this virus.
Right. Dr. HyunkyungTan, now I am aware that you were infected with the virus back in March. Could you share with us your experience?
Yes, at the beginning I was working in the COVID area of my hospital, and I got infected working there, and started with low-grade fever, dry cough, chills, muscle pain, and then a couple of days later I started with loss of smell and taste and a terrible headache. Because at that moment we didn't know anything about the virus, but that we need to be isolated and do a quarantine. I started to do ultrasounds on myself to see the involvement of my lungs with the disease. Because at the beginning I was feeling not worse than a flu or maybe a cold, but then later there's started some more concerning symptoms, like the low-grade fever didn't disappear at all, or there was a little bit of shortness of breath, of fatigue that was more prolonged than what you would expect in a flu. And it was relieving to have the ultrasound to see that actually there was a pneumonia, bilateral pneumonia going on. But then again, with the treatment, we could tackle that and treat that, and I was lucky. I fully recovered from that.
So you are not suffering from after effects such as the loss of smell or loss of taste or fatigue anymore?
Not anymore.
I see.
I was a little bit. I had after the first 2 weeks, I started to work again. It's true that during the first 2-3 weeks, I felt a little bit tired, with fatigue, with shortness of breath, with efforts, big efforts, like returning to the medical ward, to the night shift. But besides that, nothing else. I had many friends, colleagues that experienced a more severe post-COVID syndrome, like the shortness of breath, of chest pain. And then after a careful workout, we find out that they had more issues going on, like fibrosis or the microthrombosis.
I see. So your particular case is much more fortunate then. Dr. Chung-Tian, what appear to be some of the common after effects among former COVID-19 patients over there in Spain?
Well, we've been following these patients in special clinics, and we have seen that many of them, what they have is that they could have a mild fibrosis, or even the shortness of breath and fatigue that needs some special type of respiratory rehabilitation. And after a careful pulmonary and cardiologic assessment. And right now, what we are seeing is that these patients tend to recover. So what the panelists said before, it's true that we need a longer follow-up, not just 2 months, to see what's the real extent and impact of the disease.
I see. Dr. Tan, what appear to be some of the other after effects with regard to former COVID-19 patients?
The list is long. According to some reports, even 100 symptoms long. But primarily, the side effects seem to affect the neurologic system, the cardiovascular system, and the pulmonary system. Related to the lungs, we can see shortness of breath or breathlessness, chronic cough, and sometimes a tightness of the chest. The main extrapulmonary symptoms seem to be related to a condition called chronic myeloencephalopathy, chronic fatigue syndrome. This is a poorly understood disease that can be related to other viral diseases, but the hallmark is a debilitating, overwhelming fatigue. Some people can't even go back to work, or simply taking a shower really causes exhaustion. And so this is a hallmark, and we're seeing a lot of patients complain about this. Symptoms related to the neurologic and the psychiatric system include headache, difficulties with memory, concentration, and people are saying they have loss of smell and taste that persist. And then in terms of the heart symptoms, there's arrhythmia, myocarditis, blood clotting problems, high blood pressure, and these can all persist in some way or form. Some patients are saying they have recurrent fevers or muscle and joint pains, skin problems. So it's a very diverse array of symptoms that can persist for many months.
Right. Dr. Kwak, Dr. Dan just gave us a whole list of all this medical jargon as well about the side effects, after effects that is of the virus. They appear to be quite extensive. What is a possible reason for this, do you suppose?
Well, as Dr. Dan also mentioned, I could suspect a couple of different things. It seems like it's not following the usual steps the ordinary viruses do, such as other viruses usually cause symptoms because of their invasion to certain mucosal layers or other parts of the organs. It seems like this might be affecting our body in a different way, though. I could possibly suggest that it might be possibly affecting cellular metabolism in its secondary effect rather than just invading certain parts of the organs. It's also causing what's called a coagulopathy, meaning it's causing blood clots all over our microvessels and big blood vessels that blocks the oxygen supply to certain needed organs, such as the brain or any parts including muscles and whatnot. So this is rather a very new fashion of viral infection that we're experiencing. So we need to be very vigilant as to what might come next, what we could prepare for, and also in the development of treatments and vaccines, what we could do about those certain issues.
Right. Now, Dr. Jung-Jan, I believe our Dr. Dan here in the studio has a question that she would like to ask you.
Dr. Jung-Jan, thank you so much for joining us. Doctors in the UK and the US are very concerned about their healthcare system's ability to deal with chronic COVID-19 patients because of the sheer number of patients and also the potential burden financially and resource-wise to their healthcare system. I was wondering in Spain if you had any plans, your medical system had plans for how to deal with chronic COVID-19 patients. Is your infectious disease society maybe coming up with protocols and guidelines? Have you maybe set up specialty centers in your medical centers? And do you have any words of advice for the medical community here in Korea in terms of the private and the public sector, how we should prepare for dealing with chronic COVID-19?
Thank you for your question. It is true, the post-COVID syndrome was one of our main concerns, and we habilitated at my hospital a special clinic run by pneumologists and internists to follow these patients, to do the rollout of these patients. We are working through the Spanish Internal Medicine Society and Infectious Disease Society in the determined protocols, special protocols for the follow-up. But right now, we don't have a national guidelines on how to manage these patients. But at the local level, each hospital has its own protocol and its own pathway to treat and follow these patients. My recommendation would be that anything that steals, bothers, or remains, any symptoms remaining after the third week, or even more, after the 8th week, you need to have an assessment, a careful assessment for any kind of sequela that could have remained after the acute phase.
I see. That is good to know. Dr. Kwak, I believe you also have a question for Dr. Jung-Jan.
Yes, sir. So there are also people who are completely asymptomatic, and as a doctor yourself, having treated so many COVID-19 patients, were there any particular individual characteristics that are regardless of the side effects?
We have seen many type of patients. It's hard to give a prototype, a profile of how they are the symptomatics. According to our hospital experience or cohort and the studies published, seems the young patients tend to be more asymptomatic, although that's not should be a general rule to be generalized, as we have seen also colleagues that were asymptomatic and then even that developed a post-COVID syndrome. So many times could be the symptoms so lessen that one could differentiate about mild cold or even an allergy or rhinitis, that one could misinterpret that for another thing and then develop a post-COVID syndrome. or maybe they are asymptomatic and never develop any other symptoms at all. That's hard to generalize a rule, but usually tend to be younger and female.
I see. Dr. Tan, back here in Korea, how should we seek to support those who require long-term care for COVID-19 related health conditions?
Well, I agree. I think we should take an approach that depends on the duration of their symptoms. So there's a group in France that recommended that if symptoms have gone on for more than 8 weeks, that the patients should be assessed with a panel of tests looking, say, a blood test, looking for autoimmune conditions that could have been triggered by the virus, an echocardiogram looking for cardiomyopathy or inflammation of the heart muscles, and a chest CT scan looking for lung fibrosis. Also, they recommended that if symptoms have gone on for more than 3 months, then at that time we need to have a multidisciplinary team approach to taking care of the patient. And there can be specialists like a neurologist, psychologist, cardiologist, pulmonary doctor, and a rehab physical medicine doctor as well, perhaps a rheumatologist as well. A team approach to tackle all of the different aspects of what the patient is experiencing.
Right. Dr. Kwak, Dr. Dan touched upon this earlier on. I understand so SARS and MERS also led to some lasting health challenges. Please tell us more about those.
Well, there were a few studies that looked after the patients who recovered from both SARS and MERS. They found, the main theme that they found was that they found reduced lung oxygen diffusion capacity. Meaning with the same amount of inhalation of oxygen, they were providing less oxygen to the needed organs. Luckily, there was another study that came up almost 15 years later to the time of SARS and MERS that found that most of the patients still recovered within 2 years or so. So hopefully with this COVID-19, we'll see a much shorter time of recovery also. But the fact of the matter is we are still faced with a very unknown virus that does not follow the footsteps of the former virus infections. So we should still be very, very careful.
Right. Dr. Chung-Tien, not only have you suffered through the infection, but you also treat patients yourself. Now, are there any words of encouragement or advice that you would like to share with our viewers?
Yes, I would like to give a message of hope, but also that remain vigilant. This type of disease we need to tackle together. As we are not, what we learned from the first wave is that this disease is international and we need to optimize our international cooperation to share knowledge, to share any kind of expertise that could help others. And don't forget the 3 W's, to wash your hands, to watch the distance, to wear your mask, and to the government a message of to try to take the measures before having high numbers. It's not the problem with the measures. Like here in Spain, we have taken really hard measures. It's the timing. We need to implement those earlier to be more effective. And at this moment, especially since the schools are starting to open and we will face an increase, an unavoidable increase of the numbers in the following weeks.
Right. Wash your hands, watch your distance, and wear your face masks. I like that, Dr. Chun-Sang. Meanwhile, here in Korea, Dr. Tan, we have level 2.5 social distancing for the metropolitan area. Do remind our viewers again about the importance of some safety measures to be practiced even when outdoors.
Right, so we know that universal mask wearing, both indoors and outdoors, if you cannot maintain the 2 meter distance, is important. And just gathering of people, of friends, that is the biggest risk factor. If you are not meeting and gathering with other people, your chances of getting sick are much, much lower. Frequent hand washing is important because there are some high-touch surfaces, common surfaces, such as faucets and door handles that that may be contaminated, that you may touch. But if you sanitize your hands, wash your hands, then you will avoid getting sick. So COVID-19 is a largely preventable illness. If we want to prevent the acute phase, but also all of these chronic, terrible side effects, we have to be vigilant, as Dr. Chung said.
Right, Dr. Dan, as always, thank you for your thoughts. Dr. Kwak, thank you for being with us. And over in Spain, Dr. Chun Xian, thank you very much for making the time to join us live at this hour.
Thank you.
Right, well, it's time to end the program now. Do join us again tomorrow at this hour as we look at the government's plan to ease the financial burden amid the pandemic. In the meantime, do take care and do watch out for the 3 W's as announced by our Dr. Chun Xiang. Watch your distance, wash your hands, and wear your mask. Thank you for watching.